A patient with renal cell carcinoma is given aldesleukin, a recombinant form of human interleukin-2. The patient's condition improves, and a biopsy sample is obtained for further analysis. Flow cytometry reveals a large amount of cells which are negative for CD3. Which of the following cells was most likely isolated in the sample? Choice A, natural killer cells. Choice B, T helper cell. Choice C, cytotoxic T cell. Choice D, T regulatory cell. Choice E, B lymphocyte. Or choice F, normocyte. I'll wait 5 seconds and answer this question. So once again, kind of a basic immunology question because I'm basically asking you what IL-2 does, but I throw you kind of a curveball here because a lot of you will sit down and only memorize that IL-2 stimulates T cells, but you also need to remember that IL-2 also stimulates natural killer cells, which, because we've detected cells that are negative for CD3, means that we can eliminate the possibility of any T cells being isolated in the sample, which is why choice A, natural killer cells, is the correct answer. Obviously, kind of a trick question in a way, just to screw with you guys, but this has legitimately been part of a question before. So just some quick facts about natural killer cells. You of course want to remember that they're kind of the things that you fall back on when other parts of your immune system don't work properly. Most notably, when MHC1 is knocked out and you cannot recognize cells, or it indicates some kind of cell injury, that causes NK cells to basically turn on and go destroy these cells because it means that there's something abnormal going on with that cell. This can happen with cancerous cells, that can happen with virally infected cells. So they end up having kind of a similar function to cytotoxic T cells in the sense that they both use perforin and granzyme to activate apoptotic pathways in their target cells. But of course, you want to remember that they are activated via different receptors. NK cells are activated via innate receptors. CD8 cells obviously need T cell receptors. And like I said, cytotoxic T cells would be CD3 positive, whereas NK cells are CD3 negative and they would be positive for CD16, CD56, a little bit lower yield to know those things for NK cells, but good to keep in the back of your mind. So let's look at the wrong answer choices here. Choices B, C, and D are all T cells, so you can eliminate them all, like I said, because they should be CD3 positive, not negative. Now, if this question had said CD3 positive, you wouldn't really have been able to narrow it down to any specific answer choice here, technically. Although, if I forced you to choose, you'd probably pick cytotoxic T cell, if only because we're talking about a cancer here, and cytotoxic T cell probably has the most relevant function in fighting off cancer cells, but it wouldn't be a very good question. Choice E, B lymphocytes. These are CD3 negative, but obviously they're not activated by IL-2. And I guess remember that they have CD19 and 20 on them. And of course, when you hear that, you might want to be thinking about how CD20 is targeted by rituximab. So you can use it for certain B-cell diseases like B-cell lymphomas, CLL, and whatnot. Choice F, normocyte, is a distractor. Normocyte just means a normal red blood cell. So I just threw in a stupid term here to play medical thesaurus with you because USMLE also likes doing that. So this is just a video to remind you that IL-2 also stimulates NK cells in addition to T cells. So if they want to give you a question that's asking you about that, they're going to give you clusters of differentiation so that you can tell them apart. Hope you found this video helpful. I'll see you in the next one.